Hello, my name is Rivka Kaye, and my guest today is Dr. Stephen Goldfine, Chief Medical Officer of Samaritan Healthcare and Hospice in Southern New Jersey. Dr. Goldfine is a palliative care physician with more than 30 years of experience. Good day, Dr. Goldfine.
Good day, how are you?
Since 2003, Dr. Goldfine has served as the full-time Chief Medical Officer, where he oversees the care of Samaritan's hospice and palliative patients, and also serves as the liaison between Samaritan and the medical community. Would you please explain to our viewers, Dr. Goldfine, what exactly is a liaison?
So I view a liaison as being like a bridge. So I connect the Samaritan Healthcare and Hospice and our palliative care program to the community, not only the patients, but also the physicians. So my job includes education, making sure that everybody understands what's important in terms of end-of-life care and palliative care. Also focusing on the patient and the patient's goals of care, which I think is a very important thing to do.
So there's a connection.
There's a connection, absolutely.
Okay. Dr. Goldfine is certified by the American Board of Hospice and Palliative Medicine and by the American Board of Family Practice with added qualifications in geriatrics. Dr. Goldfine received his medical degree from Temple University School of Medicine in Philadelphia. Temple University is my alma mater. And his undergraduate degree from Emory University in Atlanta. To begin with, what exactly is patient-centered care? Shouldn't we assume that all care is centered around the patient?
I would say yes, we should assume that, but unfortunately in today's medicine it doesn't actually happen that way. There are a lot of goals in terms of taking care of a patient. The question is, who is setting those goals? And in today's world, it really is the physician, maybe the healthcare insurance company, maybe the healthcare system, and lastly, maybe the patient at the very end. So when I take care of patients, I look and say to that patient, what is important to you? What do you want to have out of this relationship and out of this care? And that can be a lot of different things about setting goals for that patient. And we oftentimes as physicians do not take the time to listen to the patient and understand what they really want and what they really need out of their care. For example, if you're taking care of a diabetic, for example, I think all diabetics probably want to be healthy, but if we don't explain to them what healthy is and let them help us with that, then we can't quite get to that goal together. So using their goal, we then center care around them, which becomes very important.
So the patient really has a tremendous say in what goes on.
The patient should have all the say, because we know that with medicine there are things that we should be doing, things that we can be doing, but if we're not connecting with that patient and find out what's important to them, then we really can't help that patient get through their care. In medicine, we talk a lot about non-compliance. Patients are non-compliant. Well, patients aren't ever non-compliant in my book. It's really we haven't identified what is really important to that patient. I'll give you another example. For example, smoking. Let's take an opportunity to educate that patient about what's important about not smoking, and then find out what the barriers are to that patient's inability to stop smoking. If we find and we focus on that patient's goal of care and what's important to them, we can then break that barrier down.
Okay, so I think you basically answered very completely and understandably why is patient-centered care so important to the hospice organization.
Correct. I think it becomes more important as you're getting closer to the end of your life because everything's more emotional. And unfortunately, we don't have a good definition of death in this country. We think they're going to live forever, so unless we focus on what's important to the patient. And I've been involved in a lot of cases where we as a physician group have not actually explained to the patient where they are in their medical disease process. And what happens if we don't do that and focus on what's important to the patient loses out. So for example, if you have a terminal diagnosis, like a cancer diagnosis, and your oncologist is treating and treating and treating, your goal may have been to go to Disney World with your grandchildren. You don't get that opportunity because we haven't focused on what's important to you as a patient.
Mm-hmm. Okay. As Chief Medical Officer of Samaritan, how do you ensure that every patient who is cared for in their home or in your inpatient hospice facilities receives this optimal patient-centered care?
So I take a lot of time to educate my nursing staff, and my physician staff, and my nurse practitioner staff. The first thing that we do is ask the patient, what's important to you? What is your goal of care? I often say that to my staff, get the family history, get the history of that patient, understand who that patient actually is. I'll walk in and say to the family, tell me what's been going on for the last last 2 years. Tell me your story, because the story is really important. Without a story, without that patient without understanding that patient's story, we can't care for that patient. So we do a lot of storytelling.
So when you talk about a history, it's not just vital signs.
It's not vital signs at all. And quite honestly, in hospice care, palliative care, that probably is the least important thing that we do. It really is who that patient actually is, and then what's important to them.
Why is it so important to you that the rights of patients are fully respected by both the staff and the support staff of your organization, and how do you ensure that those rights are honored?
I think if we, again, don't understand the patient's desires, we can actually cause more harm than good. And if we don't take our time to understand what's important to the patient, I think we actually, violate's a hard word, but I think we actually go beyond what we should be doing for that patient, and we can actually do things that will cause harm to that patient. And above all, we should be doing no harm to our patients. We should be really focusing on making sure that they are as comfortable as possible and make sure that their goals are met as best we possibly can.
Understood. And finally, hospice care involves caregivers, both professional caregivers or family caregivers. How does Samaritan ensure that those caregivers also understand this patient-centered care? And how is that need for compassion and patient taught to them, especially to the non-clinical caregivers? I assume that means the family caregivers.
So quite honestly, it's easier to teach the non-clinical caregivers than the clinical caregivers. I think our families want to do what's right for the patient at the end of the day. And we need to make sure we understand what is right for the patient. So again, coming back to that education, defining goals of care, I'll ask all my patients, what is your definition of quality of life? What is important to you? Who do you want around you? Who do you want to be surrounding you at the time when you're failing? What's important to you? What kind of music do you like? What kind of food do you like? And I think it's important that if we focus on those kind of issues, then we get to educate the family in doing that. We spend a lot of time with our home health aides educating the family about how to care for a loved one. I really think families want to care for their loved ones, and they want to be engaged and involved. And if we give them the opportunity, they really can be engaged and involved. Oftentimes, we, the medical society, take over. So, for example, we're in our beautiful inpatient hospice unit right now, and sometimes our staff, in their zeal to take care of a patient, will take over the daily care. Well, oftentimes the wife wants to help out with that, so we try to engage that person in that care, so that as we're washing a patient, maybe the wife helps to wash that patient, maybe wash their feet, wash their back, with the aid of our
massage or something.
Massage with the help of our aides. So we really try to do that education. I think it's also important that we empower our families to care for their loved ones, and we don't take that power away from them.
And complementary methods, techniques used here?
Very much. We have massage therapists that come in. We have pet therapists. We actually have music therapists that will help to really treat that patient in a way that really is not within the medicine of care, but within this, looking at the spirit and that soul of that patient. I truly believe that as we look at hospice patients, I view pain as not being a physical issue only. It's emotional, it's spiritual. And if we address those issues, again, coming down to the focus on that patient, then the goals of the patient can be met very, very well.
Okay. Well, thank you for this most informative interview. It sort of has enlightened people as to how the patient can be put back into the equation. Sometimes that patient has gotten out of the equation.
Thank you very much.
And it's been a very congenial interview. I feel like the viewers have known you for a long time.
Well, thank you very much.
Thank you again.
Thank you.